Good day everyone, my name is Daniela Lilian Sibana from Bachelor of Science in Nursing 1-3, and for today I will demonstrate the taking of patients' vital signs. So what is vital signs? Taking of the vital signs is an essential procedure that the nurse must do to gain information about their patient's physiological state and better visualize the patient's current health state. So before performing the procedure, prepare all the equipments and materials. So here we have our dry cotton balls, our antiseptic wipes or cotton balls with alcohol, notepad and pen, sphygmomanometer, and our digital thermometer, and our stethoscope and wristwatch. Before proceeding in taking the patient's vital signs, it is important that the nurses must perform hand hygiene to avoid transmitting microorganisms from the host to another host, or from the surfaces and the materials to another host. It is also important to introduce ourselves, validate the patient's identity and birth date, and explain the purpose of this procedure. In this way, it will help us to complement the patient's identity with their proper procedure, treatment, and other intervention. In addition, explaining the purpose of this procedure will help us lessen the patient's irritability, anxiety, and gain their cooperation. Good day, ma'am. I am Daniela Lilian, your nurse for today, and I am here to take your vital signs, in which it will help us to visualize your current health state po. Is it okay with you po? Can you please state your name and your birthday po for validation purposes?
Madeline Marcos, September 7, 1996.
Okay po, ma'am. What do you want me to address you po?
Nads.
Okay, ma'am Nads. For planning, we nurses must perform hand hygiene to avoid transmitting microorganisms from a host to another host. Also, we should gather all our equipments and materials needed to save time and avoid distraction during the procedure. Ensure the privacy of the patient by closing the door and closing the curtains, as it will show us we respect the patient's privacy. Lastly, position the patient in a supine or in a sitting position with both feet touching the floor. The first implementation is the temperature reading. Temperature is the degree of the body's internal heat. We can get it through oral, rectal, axilla, tympanic, and temporal site. So now, we will do is clean the thermometer. So here our digital thermometer. So cleaning the thermometer is in a pattern of asepsis way, which means from the cleanest to the dirtiest. Cleaning the thermometer is important to avoid contamination and the transmission of microorganisms. Now, we will pat dry the axilla of the patient to avoid moisture and help us to have an accurate reading. So, ma'am, so now I place the thermometer in the hollow area of the axilla of the patient horizontally. So after the thermometer beeps, I will take out the thermometer and read her temperature reading. So it is 36.5. So now, since that the thermometer is contaminated with the patient, we will now clean it from the asepsis way again. So from the cleanest, which is here, to the dirtiest. And store it properly in its storage box. After that, it is important to document the patient's reading, to consider it as the procedure is done. So her temperature is 36.5 degrees Celsius. So since I touch my notepad, I will again do hand hygiene, in which I will use alcohol and sanitizing my hands. So now is that I am going to read to count the patient's heartbeat per minute in her radial artery. So, ma'am, can you please? Thank you po. So what I will do is I will take my index finger and my middle finger and find the radial artery in her hands. So here. So and my thumb finger will be placed at the back of her, at the dorsum of her hands or wrist. After finding the radial artery and enclosing her wrist in my palms, I will apply enough pressure to feel the rhythm of her heart. So what you observe is that after getting the patient's pulse rate for 60 seconds, I did not take my hands off her wrist, but I observed the patient's breathing pattern for 1 minute. That the patient is unconscious, that I am counting her breathing. So for 60 seconds. So for now, I will document her pulse rate and her respiratory rate. And after touching my notepad, I will also do hand hygiene. So what I did in counting the patient's respiratory rate is that I observed her breathing pattern. So I actually observed the ups and downs of her shoulders, which indicating that she inhales and exhales. So in observing the respiratory rate, it is important to observe the depth, rhythm, and characteristic of the breathing pattern. So for the last vital signs is the blood pressure, which is the pressure that circulates blood against the wall of the arteries, and it could be obtained through the use of stethoscope and the sphygmomanometer. So before doing it, I'm going to sanitize my stethoscope, the bell, and the ears. So now, we will cuff the patient's arm. So now, we're going to cuff the patient's arm. So, ma'am, please put your arms here. So after putting the cuff, the sphygmomanometer the patient's arm. Make sure that 2 fingers can fit between the sphygmomanometer, inside the sphygmomanometer. And also make sure that the patient is sitting comfortably and the patient's feet is both at the ground. Please put your feet on the ground po. So, so now I will palpate the patient's radial artery. Just like what I did with getting the pulse rate. So after getting her systolic, which is at 100 millimeters of mercury. So what I did with the patient's radial artery is that I palpated her pulse rate. So in squeezing the sphygmomanometer until I cannot feel her pulse rate anymore. So in that way, I will get the systolic of the patient, which is at 100 millimeters of mercury. So after that, after getting the prior systolic of the patient, I will add 30 millimeters of mercury for getting her diastolic. And we will use now the brachial artery of the patient. So now we will put the bell inside the palm of the patient. And now we will pump this one up until 130 millimeters of mercury. So after getting the blood pressure of the patient, which is at 120/80, it is at the normal range po. So we will now document it. After that, we will tell the patient about our findings. So Ma'am Nads, our findings for your vital signs is your temperature is at the normal range, which is 36.5 degrees Celsius. Your pulse rate is at 81 beats per minute, which is at the normal range. And your respiratory rate it is at 22 breaths per minute. It is actually higher. So your blood pressure is 120/80 millimeters of mercury. So it is within the normal range po. So after that, thank you po ma'am for cooperating with our vital signs with this procedure po. So after doing the procedure of vital signs, we are now going to disinfect the materials that we used. You should use antiseptic wipes or cotton balls with alcohol. So we should disinfect this our stethoscope. And arrange our sphygmomanometer. arranging and disinfecting our equipment, we are now done with our vital signs